Dear ladies and gentlemen, in daily life, we often have the habit of taking medicine with milk or using milk immediately after taking medicine to reduce stomach discomfort. Many people believe that milk is benign, nutritious, and helps the body absorb medicine more easily. However, in reality, not all types of medicine can be taken together with milk. Health experts, especially Dr. Michael D. Katz, a clinical pharmacy specialist at the University of California, USA, have repeatedly warned milk and dairy products can interfere with the absorption process of certain medicines, reducing treatment effectiveness and even leading to unpredictable consequences. In today's video on the Everyday Life channel, we will explore in detail the 4 types of medicines that absolutely must not be taken with milk, why this interaction occurs, and important notes to help patients use medicine correctly, safely, and achieve the highest effectiveness. 1. Why does milk interfere with the absorption of medicine? Milk is a nutritious food source containing a lot of calcium, magnesium, phosphorus, casein, and protein. These nutrients are essential for bone, cardiovascular, and immune health. However, precisely because of its rich mineral content, milk can cause adverse interactions with many types of medicine. Calcium in milk can combine with the active ingredients of medicine to form insoluble complexes, making it difficult for the medicine to be absorbed through the intestinal wall. This reduces the concentration of medicine in the blood, thereby lowering treatment effectiveness. Casein, the main protein in milk, can also envelop medicine molecules, causing the medicine to be held back and not exert its intended effect. Additionally, the fat in milk can sometimes slow down the absorption rate, prolonging the time the medicine takes to work. Therefore, taking medicine with milk or immediately after drinking milk is a mistake that many people overlook. Dr. Katz recommends, to ensure effectiveness, medicine should be taken with plain water. If you want to use milk, wait at least 1 to 2 hours after taking the medicine. 2. Antibiotics, the biggest enemy of milk. Tetracycline antibiotics. This group of medicines is commonly used to treat bacterial infections, especially respiratory, dermatological, and urinary tract diseases. Common names include doxycycline, tetki, ocicine, tetracycline. The problem when tetracycline combines with calcium in milk is that they form insoluble calcium salts. As a result, the medicine is almost not absorbed by the body. This leads to a sharp decrease in the concentration of medicine in the blood, reduced effectiveness in killing bacteria, increased risk of antibiotic resistance because bacteria are not completely eliminated. Quinolone antibiotics. Besides tetracycline, another group of antibiotics severely affected when taken with milk is quinolones, often prescribed for urinary, digestive, and respiratory infections. Typical examples include ciprofloxacin, levofloxacin. When taken with milk or immediately after a milk-rich meal, the absorption of quinolones can decrease by 40 to 50%, causing treatment failure. Important advice: if prescribed tetracycline or quinolone antibiotics, absolutely do not take them with milk, yogurt, cheese, or any dairy products. Wait at least 2 hours. Osteoporosis treatment drugs. Bisphosphonates. Osteoporosis is a common condition, especially in the elderly and postmenopausal women. The commonly used drugs are bisphosphonates, with alendronate, Fosamax, being the most popular. Bisphosphonates are already difficult to absorb through the digestive tract, with only about 1% of the oral dose absorbed. When combined with milk, calcium further reduces this rate to nearly 0. Consequences: patients take the medicine regularly but do not achieve results. Osteoporosis progresses, increasing the risk of fractures. Recommendation: bisphosphonates should be taken early in the morning on an empty stomach, only with a full glass of plain water, and nothing else should be eaten or drunk for at least 30 minutes after taking the medicine. Thyroid treatment drugs. BCE. Levothyroxine People with hypothyroidism often need to take levothyroxine to supplement thyroid hormones. This medicine is extremely sensitive to external factors, especially milk. A study published in the Journal of Clinical Endocrinology and Metabolism showed calcium in milk inhibits the absorption of levothyroxine. Patients who take the medicine with milk or milk coffee often have lower thyroid hormone levels in the blood, leading to fatigue, weight gain, and prolonged metabolic disorders. Recommendation: levothyroxine should be taken on an empty stomach, at least 30 to 60 minutes before breakfast. If you want to drink milk, wait at least 2 hours after taking the medicine. Iron supplements. Absolutely incompatible with milk iron, is an essential nutrient for producing hemoglobin, helping red blood cells transport oxygen. Iron supplements are often prescribed for patients with iron deficiency anemia. If iron medicine is taken with milk, calcium and casein will compete with iron in the small intestine, severely reducing absorption. Some studies show iron absorption can decrease by 50 to 60% if taken with milk. Anemic patients do not improve despite taking medicine regularly. Advice: iron supplements should be taken before meals for better absorption, combined with orange juice or vitamin C to enhance absorption. Absolutely avoid taking with milk, coffee, or tea. Golden rules when taking medicine with food. Besides the 4 groups of medicines above, patients should remember some general rules to avoid unfortunate mistakes. 1. Always take medicine with plain water unless otherwise directed by a doctor. 2. Carefully read the medicine instructions, especially the drug-food interactions section. 3. Do not arbitrarily combine medicine with calcium-rich foods such as milk, cheese, yogurt, especially when using antibiotics, thyroid medicine, or iron supplements. 4. Consult a doctor or pharmacist if you have questions about the correct way to take medicine. 5. Keep a safe time gap. If you need to drink milk, wait at least 1 to 2 hours after taking medicine. Habits that need to change immediately. Many people have the habit of taking medicine with milk to reduce stomach pain. However, this method is only correct for a few anti-inflammatory drugs or medicines that easily irritate the stomach lining. For most other medicines, especially the 4 groups mentioned above, this action causes more harm than good. Some elderly people also often take iron and calcium supplements at the same time for convenience, but this is a serious mistake. Iron and calcium compete for absorption, reducing the effectiveness of both. Dear friends, from the information above, we can see that although milk is a nutritious and healthy food, it cannot always be taken together with medicine. Antibiotics, osteoporosis drugs, thyroid medicine, and iron supplements all risk significantly reduced effectiveness if taken with milk. Therefore, to protect your health and ensure treatment effectiveness, remember the expert's advice. Take medicine with plain water and keep a gap of at least 1 to 2 hours from milk. Also, don't forget to carefully read the medicine instructions, consult your doctor, and develop a scientific habit of taking medicine. Thank you for watching today's video on the Everyday Life channel. We hope this information will help you take care of your and your family's health more safely and wisely. If you find this content useful, please share it so more people can know. Please continue to follow the channel for more useful knowledge about health and daily life. Wishing you success and good health always.